Hello friends, let us now learn some important points about sexual disorders or gender identity disorders. In these sexual disorders, first let us now learn about gender identity disorders. So in this first we have three disorders in gender identity disorders. One, which is gender identity disorder of childhood. In gender identity, then transsexualism, then we have dual role transvestism. First, in gender identity disorder of childhood, this is seen in preschool years, and here there is preoccupation with dress or activities of opposite sex, that is male might like wearing the frocks. So that is gender identity disorder of childhood, where they love to wear opposite sex clothes. The child expresses the desire to be of opposite sex. He rejects the behavior, attires, and attributes of the anatomical sex. Here there is no rejection of anatomical structures. In sexual identity disorder of childhood, anatomical structure rejection is not seen. This rejection can be seen only in minorities. Then the next disorder, if you see, that is transsexualism. Transsexualism, this is more common in adolescents and adults. These people have desire to live untreated as the opposite sex. They have discomfort. These individuals have discomfort with one's own sex, and they express the desire to change the sex with the help of a surgery. So this is the main difference. uh, Here the patient tells that he is a man trapped in a body of a woman. Here there is homosexual orientation is present in transsexualism. Then we have dual role transvestism. Here patient wear clothes of opposite sex and he enjoys a temporary feeling of belonging to opposite sex. He enjoys the temporary feeling of belonging to opposite sex, but he does not have any desire to change the sex completely or permanently, and he does not have any uh, sexual arousal with cross dressing. So if you take the only difference between the gender identity disorder of childhood transvestism and dual role transvestism is, in gender identity disorder of childhood, the child does not have the desire to change the sex, whereas in transvestism he has the desire to change the sex with the help of surgery, and in dual role transvestism he does not have the desire to change the sex permanently. So in all these three conditions, if they insist to change the sex, then sex reassignment surgery can be done, or else there is no other treatment necessary. Then we have disorders of sexual orientism, disorder of sexual orientation. First we have ego-dystronic homosexuality. Ego-dystonic homosexuality. Here the individual does not accept his sexual orientation and wants to change it. So this is ego-dystonic homosexuality. Then we have phases of sexual response cycle. The phases of sexual response cycle include: 1. Desire, that is the desire to have sex. if there is any disorder in this, if there is any defect in this desire, then that is hypoactive sexual disorder. Second, excitement and arousal. In this excitement and arousal, in males there is penile erection, and in females there is vaginal lubrication, nipple erection, engorgement of size of testes, elevation of testes, engorgement and thickening of changes like engorgement and thickening of labia minora and clitoris are also seen. Then there occurs some physiological changes, especially like increased heart rate, increased blood pressure, increased pulse respiratory rate are seen. It is also associated with subjective sense of pleasure. Disorder includes erectile dysfunction. Disorder of excitement is erectile dysfunction. Third, orgasms. Peaking of sexual pleasure leads to release of sexual tension and ejaculation of semen. And there will be ejaculation of semen. In females, there will be involuntary contraction. There is involuntary contraction of lower one third of vagina, and there is contraction of fundus downwards to the cervix is also seen in females. The disorder in orgasm includes premature ejaculation and anorgasmia. Then finally, fourth stage, that is resolution, where the body goes back to resting stage. So these are the phases of sexual uh, response cycle. Next, disorders of sexual desire. Now disorders of each phase are learnt in detail. Disorders of sexual desire are of two types: hypoactive sexual desire disorder. This is, here there is lack of desire for sexual activity. It is only, and there is sexual aversion disorder. Also, in sexual aversion disorder, there is active aversion and avoidance of sexual activity is seen in sexual aversion disorder. Next, only FDA drug approved for sexual hypoactive sexual desire disorder is flibanserin. Flibanserin is the only FDA approved drug. Side effect includes severe hypotension if used with alcohol. This flibanserin causes severe hypotension if used with alcohol. Then disorders of excitement phase. Excitement phase is of two types. One, we have male erection disorder or erectile dysfunction. Then in the second, we have female sexual arousal disorder. Then in male erection disorder or erectile dysfunction, this is a recurrent or persistent inability of a male to maintain erection. This can be due to psychological factors like anxiety. This can be due to anxiety, poor marital relationship, or early morning erection. Early morning erection is also present. This will rule out presence of early morning erection will rule out the other organic disorders, and erection in REM sleep or nocturnal erection will suggest the psychogenic factor because it rules out the other organic causes of erection. Investigation is penile plethysmography or nocturnal penile intumescence can be used. Then we have physiological causes of erectile dysfunction, which can be vascular, which include atherosclerosis, and neurological, which is autonomic neuropathy. So, treatment of erectile dysfunction is phosphodiesterase 5 inhibitors like sildenafil, tadalafil, and vardenafil. These will increase the blood flow into the penis and thus helps in erection. Then oral phentylamine, the drug like oral phentylamine, alprostadil, which is PGE1 analog. This is given as injection or transurethral zone for erectile dysfunction. Then the most successful treatment, if you see, this is dual sex therapy or simple sex therapy, which is this dual sex therapy or simple sex therapy is mainly developed by Masters and Johnson's, and this is for awareness of sensory awareness. This is mainly for sensory awareness, and this will sensate. We will have to do some sensory focus exercises are being asked the couple to do. So first they will do non-genital sensory focus, followed by genital sensory focus is done in this Masters and Johnson's dual sex therapy or simple sex therapy. Then behavioral therapy can also be done. Then we have female sexual arousal disorder, that is inability to achieve adequate vaginal lubrication during intercourse, that is female sexual arousal syndrome. The treatment of this disorder is use of lubricants during intercourse. Then the next disorders are disorders of orgasm phase. In disorders of orgasm phase, first we have two, these are of two types again. One, we have premature ejaculation, and second, female orgasmic disorder. One, in premature ejaculation, there is persistent or recurrent ejaculation with minimal sexual stimulation before or immediately after vaginal penetration. Etiology is psychogenic. The treatment of this therapy is squeeze technique. Here, when the male gets feeling of impending ejaculation, then the male partner female partner or the male squeezes the coronal ridge of glands. He squeezes the coronal ridge of glands, thus inhibiting ejaculation. We have one more technique, which is stop start technique or Siemens technique. In stop start or Siemens technique, when male gets the feeling of impending ejaculation, then you will have to ask the male to stop the sex for some time, and then once the excitement decreases, then this is restarted. So these are the disorders of premature ejaculation. Then in female orgasmic disorder, it is the most common female sexual disorder where there is delay or absence of orgasmic. There is male orgasmic disorder or retarded ejaculation. This is done by psychotherapy. So these are the disorders of orgasmic phase. Then finally the other disorders. Other disorders include, first, there is dysperonia. Dysperonia is recurrent or persistent genital pain in males or females during, before, or after sexual intercourse. That is dysperonia. Second, Vaginismus. Vaginismus is involuntary muscle contraction in the outer one third of the vagina. So, this muscle contraction will result in difficulty in penile insertion. Then, third, which is nymphomania. Nymphomania, and we have cytiresis. Nymphomania is increased sexual desire in males, in females. Nymphomania is increased sexual desire in females, and cytiresis is increased sexual desire in males. So these are the important sexual disorders. Thank you guys for watching my lecture. Thank you.